what is the format of the exam, skis, long cases, the word rounds, then the Viva stations, what should be your attitude in the examination hall, and also what are the things you should carry in the exam. They are there to make you pass. It is only you who will fail if you do a gross blunder. Examination, you have to score 150 out of 300, then only you will pass. 149 or 148 will not do. Start seeing patients, start presenting cases. The total is 300 marks, and the components are the OSCEs, long cases, Viva stations, and word rounds. OSCEs are 20 questions. It is 5 marks each. The basic standard, they are not tough. It's meant to make you pass. These are the sources which you can use. One is Narendra Pal sir's book, one is the NBMS webinars, and one is the White Army videos. Stay tuned to my channel. I will be coming up with the OSCE videos. Now, long cases are 50 marks each. 20 minutes is given for each case. You get 10 to 15 minutes for the history and the examination, and then 10 minutes is for the crossing. You should be very thorough. One is the CNS, one is the CVS, respiratory, GIT, and another system which I have placed it separately is the diabetes mellitus, hemiplegia, paraplegia, peripheral neuropathy, and so on. The common cases for CVS is, of course, the valvular heart diseases, which can be multivalvular heart disease or single valvular heart disease. It can be AR, AS, MS, MR, and a combination of any of these. Then comes your respiratory case, where you can get a COPD case, a bronchial asthma case, a pneumonia, pleural effusion. Generally, pneumothorax are not kept, but you never know. And then the GIT, where, of course, cirrhosis of liver, you have to know right from A to Z, everything, cover to cover. You can get a case of jaundice, and you can get a case of alcoholic liver disease leading to cirrhosis. And these are common cases which you can't miss at all. And lastly, the diabetes mellitus, you have to know everything, because you can be given a long case of diabetes mellitus with complications, including neuropathy, including various skin lesions. One is Kundu, one is Archit Bolo sir's clinical examination textbook, and Hutchison. This YouTube channel I would definitely like to recommend is the White Army. It is the best channel in the YouTube for the clinical. Almost touched every case, which is important, and I request you to start watching those at least in 1.5x so that you save time. Here, my experience of the long case, it was very scary. I got a Wilson's disease case with a neurological manifestation in the form of wing beating tremor as a long case in my DNB practical examination. You should be prepared for any worst case scenario. Word rounds are 4 in numbers. They are 10 marks each. You can say word rounds are basically the short cases. Arthritis, one was a case of bronchial asthma, one was cranial nerve examination, and one was a case of heart failure. Viva stations are 4 in number. They are 15 marks each. There are 4 tables basically, and expected tables, one is instruments, one is drugs, one is the imagings and ECGs, and one is open table where it can be recent advances, thesis, and anything of that sort. You should not quarrel with the examiner. Try to bluff in the front of the examiner, because they don't like that. Things like the stethoscope, the hammer, the tuning fork. Reach the city wherever you are going to appear the exam at least one day before.